let me start off by saying this can be a real challenge even for trained professionals. Agitation, psychosis, and drug intoxication or withdrawal can all cause similar symptoms like confusion, paranoia, hallucinations, and erratic behavior. But there are some clues that might help you to distinguish between primarily a psychiatric episode versus a substance-induced episode. The first, when you turn up, is if you're able to get any kind of history, obviously either from family members or other people who are present, about whether this person has experienced psychiatric illness previously, and in particular if they've had psychotic episodes. Also, there's often a pattern of these kinds of episodes that start usually in late teens to early adulthood. It's possible there may be a family history as well, which may give you some clues. For substance use, the clues come from any known drug use or history of overdose. The other things to look out for are paraphernalia of some kinds. The other differences for more of a kind of drug-induced episode, they tend to be a bit more sudden, especially if the person was recently seen as functioning mostly in a normal way, and it tends to fluctuate in that once they stop using the substances, the episode also tends to wear off more frequently. Whereas with some kind of psychotic illness or psychosis, there's usually a more kind of gradual build-up of odd beliefs and behaviours and behavioural changes, and these occur usually over days or weeks. The other thing is to look for some of the physical signs that somebody may have been using drugs or alcohol. So if you're able to get close enough and see the eyes of the person, if the pupils are really enlarged, dilated, it may indicate that they've been using stimulants of some kind. If they're really pinpoint, that may indicate some kind of opioids are being used. If they're kind of got glassy eyes, it's possible there's alcohol use. And obviously, if you can smell, if there's odors, certainly alcohol or other solvents, for example, that will give you some indication that drugs may have been used. The other thing is sweating and tremors, some sort of jaw clenching, flushed skin may also be more suggestive of substance kind of induced episode. The other element is an unsteady gait or poor coordination may also suggest that there's some kind of drug use involved, drug or alcohol use. That probably, when it comes to the features of the kinds of bizarre behavior that people may be experiencing, psychosis generally tends to have more kind of fixed, bizarre delusions, often more structured hallucinations. So they have voices and they hear commands. The people will often be quite disorganized, or they could be really flat and have an inappropriate affect. With drug-induced psychosis, more likely to be vivid visual hallucinations, particularly if they've been using things like LSD or PCP, often paranoia, and rapid shifts in mood. The hallucinations can kind of seem a bit more chaotic and intense. Again, it's difficult to really distinguish the mental state of people unless you're really able to engage with them. With regard to awareness of the experience, often people with psychosis don't really realize anything's wrong. They often have poor insight into what's going on with them, whereas sometimes people who have got some form of drug intoxication or withdrawal may retain some awareness that there's something going wrong, and that it's a function of their drug use. But as I've said at the beginning, distinguishing can be tricky even for professionals. So in general, I guess when you're arriving at a scene, and all police officers will know this, is you're wanting to maintain safety first for all parties, and so you're scanning the situation for any immediate risks. You're maintaining a safe distance to reduce, particularly to reduce the number of officers to the minimum level possible, so as not to overwhelm the person. And the main thing is not to rush and to approach calmly and non-threateningly, moving slowly to avoid sudden movements. Keep your hands visible. Obviously, avoid placing your hand on your weapon or anything like that unnecessarily. Keep an open body stance with your palms out, your arms relaxed, and probably better to, if you can, to stand at an angle rather than directly face on, and just maintaining a reasonable distance from the person while you're attempting to communicate with them. Introduce yourself, explain your role and why you're there. Where you can, use the person's name, and just speak slowly, softly and clearly, and try to use simple, non-technical language. Where you can, allow the person to talk and to explain what's going on for them. You reflect back your understanding of that, particularly by reflecting the feelings that they might have expressed. And it's not that you're necessarily agreeing with everything you say, but in general, avoid getting in, if they're deluded, for example, avoid getting into challenging delusions or hallucinations, and focus more on kind of their emotional response rather than the content. The key really is to go in and create a calm approach and environment. So avoiding large numbers of people and crowds and a lot of noise, such as flashing lights or sirens or anything like that. Where it's appropriate, try to offer choices for the person. Things like, would you prefer to sit over here so we can talk about this, or is there somebody we can call that you feel okay talking with? So the general idea is you're trying to give them some sense of control over the situation. If you have the scope, it's always helpful to ask them what they need. What is it that you can do that might be able to help them in the situation? Sometimes people are responsive to that. Again, if there are people that they have worked with previously, so it may be that you're aware that they've been involved with the mental health system, then you might want to see if there's somebody that they want to talk to from the mental health service, or if you're fortunate enough to have support from the mental health team, then they may be present at the scene as well. The first thing I would say is having some level of self-awareness about when you are experiencing stress. Often we refer to this as kind of a stress signature. Everybody has one, that they're all slightly different. For some people, they may notice that their sleep's affected, or their appetite, or they're just more irritable and short with people. So it's always useful to think about, well, what do you know about yourself in terms of how you respond to stress? And one of the other things in terms of police work is that the experience of mental health difficulties in response to some of the police work that you're engaged in can be cumulative, and so it's lots of small things that may add up over time. And so just having an awareness that it may not be one single difficult event that you've had to deal with, but an accumulation of events over time. But yeah, so the first thing is awareness, and really it's about good maintenance work around sleeping, having good sleep habits, exercising, and having good social support or general support, and that mostly refers to being able to share what's going on, and it may be in relation to your police work or in other areas of your life, rather than just kind of keeping it all in and keeping it to yourself. So one of the main things is increased awareness, some good maintenance work. I mean, obviously, a moderate level of alcohol intake, not drinking alcohol excessively, sharing things with colleagues, and it still helps if you have a sense of purpose in the work. I think that's really important, and if you notice that that's started to reduce, that's probably a sign things are not going well. And then if you do identify that you're struggling a bit, then reaching out for help and seeking help either through your GP. It's possible that you've got some kind of scheme within the police force, somebody you can speak to there who's a mental health professional. And there are lots of psychological treatments available depending on what the difficulty is that have been shown to be effective. What we are aware of is that your police are often a bit resistant to getting treatment for all kinds of reasons. They're resistant to taking leave, and the stigma, obviously, of seeking mental health help, worries about the effects on career, and lack of organisational support. Hopefully those things are changing in the police force, and your mental health are pretty critical to not just doing a good job in the workplace, but in life in general. So main thing, early identification, reaching out to people, and seeking help when necessary.